Now you have questions about Ebola, and we are getting them answered for you. Dr. Jim WIlde, he's back. He's been talking to us about Ebola. He's an emergency medicine physician and an infectious disease specialist. Dr. WIlde, thank you for staying with us this hour. Before we get to our viewer questions, the one, and we've been talking on and off during commercial breaks, but the one thing a lot of people want to know is, what can we do to prevent the infection, and is there a vaccine for this?
Well, prevention is just basically staying away from people who have Ebola. If you can't, and that's the problem with medical personnel can't stay away, they have to take care of the victims, then you have to try to do the best you can to protect yourself by using gowns, gloves, masks, things like that. As far as a vaccine, there is no vaccine for Ebola, at least not yet. Mm-hmm. There is work going on. The Canadians have a prototype vaccine that they're about to start trials on, and the United States also has several prototype vaccines. The problem with vaccines is it takes many months and sometimes years to develop them. And so we will almost certainly not have any opportunity to use a vaccine against Ebola in a widespread fashion for at least 3 to 6 months.
Mm-hmm. And like you mentioned, it's a time thing. It takes time to create something like this.
It's extremely labor intensive, it's extremely expensive, and it does take time to be able to show that the vaccines actually work.
Okay, let's get to some of our viewer questions here. We've got one that we want to get to. John's asking, is exposed skin at risk when caring for Ebola patients?
Absolutely, exposed skin is at risk. You have to be completely covered, and that means having an impermeable gown. That means a gown that does not allow fluid to soak through and touch your skin. You need to have gloves on, you need to have a mask, you need to have a face shield. The Ebola virus is exquisitely contagious. It doesn't take very many particles. Very small amount of contamination will allow the virus to pass from one person to the next, and that's why the biggest risk group is healthcare professionals. The doctors and nurses taking care of the Ebola victims in Africa are at huge risk for getting Ebola themselves.
And when you mentioned that the sleeves and the gloves and everything, it's similar to what a hazmat worker would wear.
Correct. Correct. These are specialty pieces of equipment that we rarely use because we don't have infectious diseases of this nature in usual course of doing business in an ER or in a clinic. I mean, for instance, if you want to look at some of the really bad bugs in world history, the flu of 1918 that killed millions of people, 2 to 3% mortality. 2 to 3 out of every 100 people would die from it. With Ebola, the mortality rate is 70 to 90%. Highly lethal, almost as deadly as getting rabies.
Yeah. Okay, let's move on to our next question. From Jeffro, how was the spread of Ebola similar or different from seasonal flu? And a lot of people are starting to get their flu shots now. This is a pretty interesting question here.
Yeah, it's a good question. Flu is exquisitely contagious, just as Ebola is exquisitely contagious, but it's also easier to spread flu than it is to spread Ebola. Ebola, you need to have some contact with fluids, bodily fluids from the victim. With flu, it is spread by the respiratory route. So in other words, if you're walking through an airport and somebody coughs, just those particles that are suspended in the air can get into your lungs and can cause the infection in you as well. In general, viruses that are spread by the respiratory route are much, much easier to spread than viruses that are spread by contact. Flu spread around the world in 6 weeks back in 2009 during the pandemic. That's typical for respiratory viruses. The reason this virus is not likely to spread like that is because there is no respiratory spread, or at least probably no respiratory spread with this.
Okay, Dr. Jim WIlde, you have really given us a lot of insight into this, hopefully easing a lot of your fears, a lot of your questions getting answered this morning. Thank you so much for coming in and helping us really cover a lot of bases on this.